Thanks for inviting me again, Annette. Appreciate that. So, we're going to talk about our vision system today. So we don't talk a lot about our vision, except when we have problems with seeing or being comfortable in different places or different activities. So I've been up here a few years. You can just take a look at where I have been over the years. It was from the information on the screen. As I mentioned before, we don't really think too much about our vision, except for if our eyes, if we have some injury, or if we can't really see clearly. So there's a lot more to vision than being able to see clearly, and we'll expand on that as we go along. So the first thing actually is to convey some information on what really is involved with vision and how the vision system is intimately connected with our brains and how things need to work together so that things work automatically. So how many people have had a brain injury? Okay, so I've had a couple of concussions, and probably has affected my memory, my communication. Fortunately, I can still do things and be able to interact and to be able to feel pretty good. A lot of people with brain injuries certainly can't. But we can see from this information that you're looking at, there's a lot of signaling from our brain, from our eyes to our brain. And there's a lot of areas that are connected with vision, besides being able to see clearly. The second to the last bit of information is that a lot of the signals, or almost about 8% of the signals, 12% of the signals, are sub-visual signals. It helps the body, it helps the listening system, our auditory system. It affects a lot of different things that we'll be talking about a little bit later. So one of the main areas that the vision has to interact with is our vestibular system, which is signals from our ears, from our, there's semicircular canals, otoliths, that directly connect with our vision system, our eye muscle system. So as we turn our head, in order for our vision to be stable, we have to have our eyes do something different, and actually opposite directed movement. So we can actually overcome when we look to keep our eyes in the same position and move in the opposite direction, but it's difficult. So let's have everybody try to move their head to the right and then look to the left. Go ahead and try to do that. So you're looking straight ahead and you're moving your head, but your eyes, you want your eyes to move in an opposite direction. Or actually, yes, so it's not as easy as, we can override this automatic reflex basically, but is there to give us stability. And we'll talk about when that those connections are disrupted with brain injury. So most of the people here involved with working with people that have had head injuries. Would that be correct? Okay, good. So these are common things that you probably hear with what people are experiencing after they've sustained a injury. And all these things that are commented on, that people experience, a lot of these things involve the vision system. So we can go down the list And light sensitivity is a major disruptive factors and experience that a lot of people have. Well, we'll go in a little bit why that is promulgated with injury. But we're going to talk about these things as we go along, and more things that are involved with our brain and how our brains work, and when there's a disruption, these things are evident for a lot of people. So, not only things that are involved with the injury itself, but there's other things that make the vision system less able to adjust and less able to be automatic. And so there's an internal environment and an external environment. So, and we don't think too much about these things, but if there's body pain, that's going to sort of focus our attention. And so things that are usually work automatically can't work very easily because our attention is directed to just something that is more dominant, let's say. So that's the external part of this environment. But the internal environment, there's problems after injury that affect the interactions, the hormonal system, that can be dominated by a major disruption, basically. And so, and then there's things that the person sort of arrives to after injury, or before injury actually. There's a certain type of people that will try to persist with a lot of pain, a lot of discomfort, or some people that actually will give up pretty easily when they are doing things because that's their nature, basically. So there's things that affect recovery from injury that are both psychological and physical as well. So I've seen over the years a number of people with head injuries. And so there's a common area of concern with people. So how many people like to read? Okay, pretty much everybody. Good. Okay, so what? We're going to do a little demonstration about what's really involved with reading, and so I'm going to actually see there's probably enough people we can do this with. We don't think about what our eyes do when we're reading, basically. So I'm going to have everybody, so let's just pair up a little bit. This will be good. So I'm going to have each of you, get back to you there. Put this over here. So once you pair up, and you can pass this around. So I'm going to have each of you read this little paragraph silently to yourself, and I'm going to have the other person look at what the eye system's doing, basically. So it just takes a minute here, but it'll give us some insight and some feel for a little bit of what's involved with reading, basically. There's a couple more coming around the other side. So pair up, look at the person's eyes when they're reading silently to themselves, and then we'll talk about what everybody observes. So then read, and then change so that both people read and both people observe. So, but you have to really look closely at the person's eyes when you're reading. So go ahead and read. And you look at her eyes. Go ahead. So you read to yourself, you look at her eyes. Yeah. And so actually we have to look up here because we can't see her eyes. Okay, you can get your eyes up. Okay, yeah, okay. Look at her eyes really closely, and then we'll talk about what everybody has seen, basically. Okay, so let's talk about what people have observed. So let's start with you. So, okay, so now what did you see?
There's just a lot of different impulses happening at once. So movement of the eyes from right to left, coming from left to right. I have to remember what language we're using.
True, good. So was it a smooth movement or a jerky movement?
Well, sometimes smooth, sometimes jerky, depending like if you're at the end of a sentence, or it's like, yeah, it would change.
Okay, so how many people saw jerky movements when they were observing a person? Okay.
In the eyes or the head?
Well, that's a good point, because the eyes are more, if we can move the eyes without moving the head, we're more efficient when we're reading, basically. The head weighs 3 or 4 pounds, the eyes weigh 3 ounces. So if we can use that system easily, then we're more efficient when we're looking at these little words on the page, basically. So yes?
I'd almost say it's more digital than jerky, if that makes sense. Like it's very precise. I don't know.
That's a good point, because that's more efficient to be more consistent, basically.
Yeah.
So so there is actually a stop-start pattern. So a good reader that reads 100 words, how many times do you think they stop? Okay, how many times? 5, 10?
Maybe less than 5 or 10, yeah.
Okay, anybody else? 30, 40, 50?
100 words, is that what you're asking?
Yeah, 100 words, yeah. They read 100 words themselves, and there's, the reader, how many times would you think they stop?
It really depends on, I think it really depends on the person and what they're dealing with.
Exactly right. Well, if you're a good reader, you're going to get more information. But unbelievably, we can measure that the eye system will stop 50 to 70 times when they're reading 100 words.
Wow.
So that jerkiness, that digital jerkiness that we saw, is that stop-start pattern.
Yeah.
And so the efficient reader will stop less, get more information per stop, and not have to go back to reread. Even a good reader goes back to reread a word or a portion of a word 10 to 12 times, which is pretty amazing. So now, and there was reference, or there was mention that the people saw a bigger movement from the right to the left to start the next row. Now, were the words clear when everybody read? I hope so, because if not, you need to see an eye doctor, basically. So now, did anybody get double vision when they were reading? Overlapping words, or just start double vision, basically. Okay, so the eyes had to work together, they had to focus, the eyes have to make these individual movements and a large movement from one line to the next line. And then the next thing, of course, is the understanding of what is read. So what did you read?
I read that it was depending upon the way you interpret it, it could be more efficient in terms of the pattern that you were exercising in the process.
You put a lot of information in there that wasn't there, actually. And most people wouldn't understand or remember what they read, to tell you the truth, because there was something else going on. And so, so that is understandable, that if things aren't working automatically, if we're not sort of attending to the information, we're not going to really get the information. It just, that just said that the information was just a lot of visual skills go into reading, basically, that we don't really think about. And so the problem with after an injury, the eyes have a lot of problems with doing things automatically, particularly for reading. So what is involved with reading, as I just mentioned, small eye movements, larger eye movements. We're doing a lot of things, processing what we see, or imaging what we see. We're putting words together to form a thought, and we're doing things in this automatic fashion. So when, after an injury, there is often disruption to that automatic ability to do all these things at the same time. So that's going to affect concentration and the desire to read. So a lot of people with injury are going to, even though that's one of their main exciting things in life, are going to avoid reading, basically, which is really sort of unfortunate. So let's talk about some other things that the vision system is involved with. So let's have everybody stand up for a second. You might have done this before. And let's have everybody stand on one foot. And then close your eyes. So a lot of people actually are pretty stable, but a lot of people aren't. So it's really, so our vision gives us information on our surrounding areas. Everybody can sit down. So when we are moving, we need to understand what the environment is and how to interact appropriately. But all of the movement patterns are automatic, involving the body system is integrated with the vision system. So here is a number of things that are involved with moving. You can take a look at a lot of these things that everybody's aware of. But again, we don't think about this as we move. We just move because we have the experience and we do it automatically, basically. So the other common thing that is, well, this just involves a lot of things that we do around the house and do during a day-to-day type of experience that we all have, basically. So why is doing ordinary things so difficult for people after a head injury? There's a lot of things going on, and the vision system has to make adjustments in this easy, automatic fashion. And so you can take a look. So let's just take a look at a number of these things here. So one of the things that is mentioned almost 100% is the motion sensitivity. So our eyes and our stability of our environment needs to be in place, and when it's not, then we have problems with information in our peripheral vision, basically. So a lot of people have difficulties with watching a movie, let's say, because there's a lot of movement from different, I mean, some movies are more complex, more busy than other movies. The computer is a problem with a lot of movement with different screen viewing and looking around. So one of the common concerns and disruptions is being able to be in an area where there's a lot of movement with people or with cars or with kids running around, basically. And so stores are a real problem with too much going on. And our world really is, the light sensitivity, the photosensitivity is, can be very significant. Is the first couple slides that I showed about the neurology of the eye system. There's so much information coming into our brains from our vision that it's often not able to being able to filter out, so that there is an overload. And so when there's an overload, we can't interact, communicate, think properly. So we're sort of don't want to go out of the house, basically. And even in the house, we're constantly changing where we look. And you would think that's, again, if that system is disrupted, moving the eyes as well as changing eye position, then it's difficult to be comfortable. We get tired trying to do things, and it's sort of a sensory overload, basically. So one of the things that we don't realize that our eye system does is to make changes. So let me, now everybody's sort of in a group, so let's have everybody look at their partner, put a finger up in front of them, and then move it closer to their eyes and see what the eyes are doing when you get close to the eye system. Well, watch what the eyes are doing. Yeah, so one person moves the finger, the other person watch it, or actually one person can just use their finger to look close, and then that person can see what the eyes are doing when they are looking really close.
Crossing an eye hurts a little bit, yeah.
Okay, that's a good point. Okay, so when we get to a certain point, so our eyes are making a change. And so our eyes, when we get really close, like I can get really close to my eyes look like they're crossing, but our eyes are actually crossing where we're looking when things are closer than 12 feet. So when we're looking far away, our eyes are in a parallel position. 12 feet and closer, our eyes have to converge. And and are at the reading distance and at the working distance that, within our hands reach, our eyes are converging quite a bit, actually. And so a lot of TBI patients, people, when their hand has to be out here, and then they can't, it's sort of difficult even at their arm's reach area that they're comfortable. The eyes can't converge, or they can converge, but it doesn't feel good. You have to use a lot of energy.
Right.
And so that's going to make it a challenge to do things around the house because you sort of have to make those changes. And particularly for computer reading, that sustained viewing can be very challenging for a lot of people that have had head injuries.
And how long does that take to improve?
That's a very good question. Sometimes, like most therapies, we'll talk about what can be done to help people with their vision problems, but sometimes it doesn't improve. Sometimes there's problems with the neck that are influencing what the eyes do, actually. There's signals, pathways that go from the centers of the brain to the eye muscles that are disrupted so the signals don't get to the eye system to coordinate the two eyes work together, basically. And so that's a challenge. So a lot of people will have problems if there is neck stress, for sure. Oftentimes we can stimulate the eye-brain system to be responsive and be more automatic, basically. So we'll go over that a little bit as we finish up here with some of the treatment that can be done, basically. So this just shows that most things that we do day to day involve the vision system, of course. Okay, so most people haven't heard about the Neuro-Optometric Rehabilitation Association. It's been around, as you can see, for 30 years. There's actually eye doctors, optometrists around the country that work in rehab centers and hospitals to help with people that have had injuries. But as you can see, we work with other disciplines. So it's sort of it's necessary to put the pieces back together. And vision is a big piece oftentimes. It's often overlooked. So what are the tools, what things that can be used to help the vision system work more automatically, more in a more integrative manner, basically. And so a lot of these things that I list are pretty common, but the application of these things require a different approach to what the vision system does and how it can be supported with different tools that are available. So we're going to go through each one of these real quick. So lenses are pretty common. Everybody has seen people with eyeglasses and with that help with the clearness of vision. But there are lenses that do something different, that affect different parts of the brain, that are that can modulate signals that can support better integration of vision and other body systems. So one of the things that is disrupted oftentimes is our sense of positioning, body positioning. Sometimes, particularly a person with a stroke that might have had parts of their body, usually the left side of the body is not functional because the right area of the brain has been disrupted. So sometimes lenses can shift these signals that can make a difference in stability. A lot of people, even younger people, so when I actually work with a lot of young kids, and their focus system, it can adjust pretty close to their eyes. So at about 3 inches from their eyes, kids until their age about late 20s could focus about 3 inches from each eye, basically. As we get older, of course, the focus system doesn't work as effectively. And so these are actually reading glasses. I can't really see too good, but I can see good enough to interact, basically. But most people over the age of 50 need reading glasses because the eyes lose the ability to focus. But we still can adjust. So sometimes with injury, that adjustment is not there. So we need a little bit of support that can make a big difference. A lens that might not have any effect ordinarily is going to have a real big effect with somebody that might have had an injury that has disrupted the focus system, basically. So lenses are one tool. Small changes can make a difference. And sometimes actually, the first one's really interesting because we expect that glasses help us see more clearly. Sometimes that's too much. So actually, reducing the clarity makes a person feel a lot better. And yeah, really? So you've experienced that?
I hate these glasses.
Uh-oh. That's okay. Well, that's a challenge because, well, a little bit can make a big difference, and it might make a big difference in your
I wear
situation.
them like this most of the time.
Okay.
Because here it's just too much.
Oh, okay. Well, that's not where you want to be, of course, for sure. So I would go back to my doctor.
I did,
Oops.
but he was very arrogant, and he said, I like what I prescribed you, go away.
See Dr. Keene.
Yeah, I would knock on a different door. I don't know. Yeah, so no, but it's, but for people that have had injury, and softening prescription can be very significant. So the other tool that is available is prisms. Who knows about prisms, or who has tried prisms, or have any experience with prisms? Prisms are just lenses that have a thicker edge, and because of that thicker edge, the signals are different coming into the eye, actually. And also, the thicker edge, the eye turns away from the thicker edge, basically. And so the prisms can be in the same direction so that the eyes move over a little bit, or a lot sometimes, which helps, either laterally or up and down. And the factor is why these can be significant is that different parts of our retina, the inside of the eyes, go in different parts of the brain, basically. And so changing signals can either bypass damaged areas in the brain, go to areas that can make things work more easily, and help with understanding our space better as well. So they have some use and can be very significant for some people. one of the things with a stroke patient oftentimes is that their understanding of where middle is disrupted. So changing that with prisms can help them be more stable, basically. And that can help with other rehabilitation that they're going through with physical therapy, with occupational therapy, and with communication, basically. So one of the things that we see with helping a significant system like the vision system is other systems will be enhanced as well. So prisms are it can be a tool for support for people that have head injury. So occlusion. So what is occlusion? So occlusion is blockage, is reducing signaling from our vision to our brain, basically. So I saw a lady a couple days ago that I put on some tape, some Scotch tape actually, on the inside of her lenses, and immediately she felt calm. She was able to ride home and look outside. She had less headaches because it changed the input from her vision system to her brain, basically. A lot of people can benefit with some type of change in their signaling, whether it be with occlusion or prisms or lenses. And the next thing is tints. So tints is just different frequencies of light that impact the brain. So when one of the first slides that I showed you was that, which might have been overlooked a little bit, is that our vision system, our eyes, are part of our brain. And so there's signals from the brain to our eyes, and signals from our eyes to our brain, of course, for sure, so it goes back and forth. So changing those signals can be helpful to have the brain work better. And that's what we're trying to do with the patients that we see. So different tints can be too much, be calming. Sometimes there is, one of the things that our bodies and brains are adjust to and sort of be more functional with is change. We're constantly changing, basically. So if we can adjust to change more readily, then our system doesn't get stressed. And so just like climbing 4 flights of stairs, our heart's going to be beating pretty fast. My heart will be beating pretty fast. But the challenge is to have the heart calm down as fast as it can, or as fast as it can, so that we're at a resting state. So the vision system can be overstimulated, and then we can train it through different activities to calm down, basically. And that's part of the next thing is vision therapy. So how many people have heard of vision therapy? Okay, so most people, or half people it looks like. So vision therapy has, it's similar to other therapies, basically. The eye system is a sensory motor system. The eyes have 6 muscles that move the eyes to different places, coordinate the two eyes, and enable the eye system to adjust to where the person's looking, basically. What is not recognized is that the muscles, each muscle is about 100 times stronger than needed to move the eye. The eye is only 3 ounces, and these muscles are pretty large sized muscles. And so there's a lot of coordination with different parts of the brain. One of the ladies that I was just reading about said that the prefrontal cortex is very involved with moving the eyes, as well as the parietal lobe, as well as the cerebellum and brainstem. So there's a lot of coordination with just moving our eyes from one spot to another spot, basically. And so oftentimes with injury, those signaling is off. There might be a timing issue, there might be less signals that are going to different areas that can be supportive of doing things automatically. So vision therapy has been around for a long time, and it involves changing the brain, basically, to work better. So our brains work more fully when things are more complex. And so we can change different signals through different activities. And just like your question about can the systems change with, it's just a sort of a step-by-step activation to make changes in these different systems. So the answer is most of the time people can learn, practice, and make changes to do things more easily. So just the convergence of the eyes moving, getting more peripheral vision, and dealing and being able to be comfortable with it can be supportive of different activities. And this is what vision therapy is involved in. So vision neuro-optometric optometrists work in this disciplines of support for people that have injuries. So I've seen a number of people over the years. Everybody's different, and so we have to sort of figure out what is going to be the best support that can be provided, along with other disciplines to support getting people back on their feet. Everybody wants to work and feel better, and be able to be who they can be, I guess. So with that, I will open the platform here for questions. I'm in the Eagle River. There's actually only, up until a couple of years ago, I was the only provider in the whole state of Alaska that worked with patients with head trauma and other more functional vision problems, basically. There is now an office in South Anchorage, Katmai Vision Clinic, that is involved with supporting this discipline as well.
What's that called?
Pardon?
What's the name of the South Anchorage?
It's Katmai Vision Center, I think. They're on Otsego Highway, sort of by Hoffman. So is there any questions that I can answer? Yes.
Okay, I have 2 questions. Can severe stress or trauma cause TBI symptomology with the eyes like you treat? Emotional stress cause the the kind of things you treat?
Absolutely. Absolutely. So one of the things I tell parents when we work with their kids, after therapy, their eyes are working properly, efficiently, but with either head trauma or a significant psychological event, stress, it's the person or the child will go back to their original patterning and default and dysfunction, basically. So significant stress can reduce vision ability, for sure.
At what point is introducing vision therapy after a traumatic brain injury? Is there a specific time frame before you're able for someone to heal, depending on what the injury is?
That's a very good question. The old thinking was 6 months. If you're not well in 6 months, then there might be something else that can be done, basically. So PT, OT, speech starts immediately after injury. Vision considerations, therapy, or the tools that are available should be used immediately. And that's really the missing link because of the misunderstanding maybe of what the vision can do and how it can be supported. Okay, thank you. So, good question, and it's not being done as quickly as it can be internationally. Yes.
So you had mentioned light sensitivity earlier for folks that have experienced a traumatic brain injury or stroke. And I was wondering if you've also seen where there is a lack of light that also presents the same kind of disruption or irritability with the brain as the brain is trying to take in information, as opposed to receiving too much, receiving too little, and posing an issue.
That's a good question. So when we can't see our environment or understand our environment, we're not going to be comfortable. We're going to be sort of fearful or concerned. So nighttime, particularly nighttime driving, I get a lot of problems or a lot of people that have a hard time doing that because of lack of light, lack of information, lack of where they are, basically. And so that's a very good question, and so it's a balance. Too much or too little can be disruptive, basically. This has been a privilege to be here, and enjoy the rest of the conference.
Thank you so much. And a round of